My name is Andre Gagiano and I'm a pharmacist working at the Pharmaceutical Society of South Africa. What I do is quite interesting. It's a different side of pharmacy. It's part of pharmacy that most people don't see. I'm involved in policies and legislation changes, and I'm involved in informing members of our society about changes and how to practice to be safe and to be within the law. I still do locum at private hospital pharmacy. I feel it's important to stay up to date. You will work one weekend and 2 weekends later there'll be a new drug on the market that you don't know anything about. So in 5 years you could actually be a danger to society if you don't stay up to date. Since I was small, I always ask my mom, but how does the medication know where to work? It's baffled my mind since I could understand it. When you take medication, it needs to work somewhere. I was about 12 when I started saying I want to be a pharmacist, and I ended up becoming a pharmacist.
So what is a pharmacist? What does it take to become one? What role do pharmacists play in our healthcare system? Are they there to only dish out or sell medicines to the public? How are these medicines regulated to ensure that they are safe for consumption? And why are these medicines so expensive anyway? Who sets the price? Perhaps most importantly, how can we ensure that medicines are used responsibly and safely? September 5th to the 11th is National Pharmacy Week, and the theme for this year's campaign is Use Medicines Safely. So today we discuss pharmacy and health. We've assembled a team of experts to tackle the questions I posed earlier. Now, this panel is comprised of the Registrar, CEO of the South African Pharmacy Council, to enlighten us on regulatory matters, Head of Public Affairs at the Pharmaceutical Society of South Africa, to learn about all pertinent matters in this pharmacy profession, a pharmaceutical industry expert from Impact RX IMX Health, and a principal officer of a medical aid in South Africa to understand the ins and outs of the pharmaceutical industry and how medical aids deal with issues of medication. So sit back, relax, and learn from this exciting show ahead. Interact with us on Twitter at SABC Health Talk or on our Facebook page, SABC Health Talk. I'm Dr. Sello Mutaung, and this is Health Talk.
Pharmacists play a significant role in helping people get the best results from their medicines. They are considered as health specialists who are most accessible to the public without an appointment. Pharmacists are responsible for, amongst others, supply of medication to patients in accordance with doctor's prescription, ensuring that the supply of medication is within the law, advising patients about their medication. Dara Vucevic, a pharmacist at Mays Chemist, says the profession has been fascinating and educating throughout her 20 years of experience.
Pharmacy is an enjoyable profession. You get to interact with the public all day, meet new people all the time. You're exposed to different and new illnesses and new medications and new treatments that are available for different illnesses. So you're always learning. You're learning and you're expanding your knowledge all the time. And you build relationships with your clients, especially if you're working in a community pharmacy. You're building relationships with your clients because there are people that are coming in all the time, and if you've given them good service, they tend to come back and they trust you. You build up a relationship with the clients, and then it also benefits them because you're aware of their medical history and any kind of ailments that they might be used to, and then don't think to mention it to the doctor, which ultimately affects the way their medication can affect them at the end of the day.
Essentially, pharmacists help people with almost anything related to the use of medicines, which means they help people to stay as healthy as possible. Vucevic says the profession comes with a lot of responsibilities and functions that are in the public domain.
Interpreting the prescriptions as they're written by the doctor, they're supplying the medication to the patient, giving the patient information about how to take their medication, possible side effects, how to store their medications. Then when it comes to screening, a lot of patients, they suffer from common illnesses like hypertension, which is high blood pressure, or cholesterol, and these are illnesses that often don't have symptoms. You don't experience anything, and so you're not aware that you suffer from these things. So often screening will help to check if you are at risk for these illnesses, if you do have high blood pressure or if you have high cholesterol, then the pharmacist can refer you to a doctor or to a clinic so you can get further care.
Like many other professions, the pharmaceutical industry has its own ups and downs as well.
Patients often want to self-medicate and think they can handle the situation on their own, and even when they're advised to go and see the doctor, then they are reluctant to do so. Sometimes it's just out of cost or time, or they want to believe that they are healthier than they are. So sometimes convincing the patient of being referred is sometimes a challenge. Also, the long hours involved in pharmacy is also another challenge. We often open the whole day, sometimes late into the night. We're on our feet the whole day. And then another thing that also is becoming increasingly a problem is medical aids and all the admin that around medical aids and all the restrictions about medications that they supply and don't supply, which also frustrates the patient and then frustrates the pharmacist. And so always trying to work around that.
The pharmacy graduates of today face a wide range of career options, ranging from development, quality assurance, production, registration, marketing, or research.
It's important to know that the sustainability of the healthcare system and the national economy depends significantly on the availability of affordable medicines. When desperately needed drugs may be too expensive, people pay both with their wallets and their lives often, it's often said. Now, to learn more about all of these issues, and we're going to focus a lot more on the pharmacist and the pharmacy, and perhaps most importantly, safe use of medicines in this program. But let me introduce my special guest for this morning. It's a great pleasure for me to welcome on my extreme right, Amos Masango, who is the CEO/Registrar of the South African Pharmacy Council. Welcome to Health Talk, Mr.
Thank
Masango.
you, and
Right.
morning to the interviewers.
All right, and next to Mr. Masango, we have Tracy Minnie. Now, Tracy Minnie is the commercial manager at a company called Impact RX IMS Health. Welcome to Health Talk.
Thank you very much.
Okay, and last but not least, Lorraine Osman, who is Head of Public Affairs at the Pharmaceutical Society of South Africa. Welcome to Health Talk once again.
Thank you so much.
All right, perhaps let's start with a very simple question, and I'll throw it to any one of you. What does it take to become a pharmacist, I asked?
I have a standard reply to that.
Right.
Blood, sweat and tears.
All right, okay.
It's quite a long course. It's a 4-year academic course at university, followed by a year of internship in a practical situation, and then a year of community service for the public sector. So it's quite a while before our young people start flying, but they do get there.
Now, tell us a bit about the Pharmaceutical Society of South Africa. What is the society about?
We're a professional association, a voluntary association, and we represent people working in pharmacy. The majority of our members are pharmacists who are registered with the South African Pharmacy Council, but we do have pharmaceutical scientists who join as well, and we have some pharmacy support personnel. We have pharmacist assistants who are also professionally trained people.
Okay, and what's the difference in the training between assistants and pharmacists?
That we are heading towards having a good mid-level worker that the public sector can depend on.
Right.
So we started off many years ago with having some fairly basic education, which is actually at about a matric level.
Right.
And these people are given certain functions. They do need to work under supervision of a pharmacist, but we are also working towards introducing a mid-level worker who has a post-matric qualification, who will be given a little bit more professional independence and might be extremely useful, particularly in the public sector.
All right. Mr. Masango, talking about pharmacists, I mean, the council, I would imagine, registers pharmacists and pharmacies. Is that correct?
It's correct.
Yeah.
Yes. And the council, as you know, is a statutory body, which is entrusted with the profession of pharmacy. So it's put together by an act of parliament, in other words, yes. So mainly we look at the whole aspect of pharmacy. I mean, starting from education and training, and ending up with practice and professional conduct of a pharmacist.
Okay.
So
how many pharmacists are registered currently? Do you know?
We have more or less 14,000 pharmacists registered.
Okay.
And then, but if you take into account the, the pharmacy support personnel, what you just talked about, and then it comes to more or less 26,000 people on the registers of pharmacy. Yeah.
Mm-hmm. Tracy, the pharmaceutical industry is said to be a huge industry worth, I think, somewhere around 37 billion rands or something.
Yes, and actually we think that by 2020 the South African pharmaceutical industry would be about 47 billion rand. So yeah, very diverse and
perhaps just take us through the landscape of the pharmaceutical industry as we have it in South Africa. I mean, medicines are manufactured by people, and how do they actually get down to the person that consumes them?
Yes, so yes, there is a landscape in South Africa, and I think sometimes we should even take a step back, that our man in the street actually realizes that there's a lot of money invested in medicine, in the research and development of medicine. So there's the research and development, there's all the trials that go hand in hand with that. So it takes many years, and it takes a company a lot of money to make sure that a safe drug gets to market. Once it gets to market, then we have the manufacturer, and then the manufacturer that would then sell it to a distributor, who then would sell it to a wholesaler, and from wholesaler it moves out to courier or to pharmacy, to our supermarkets, and then in South Africa we also have dispensing doctors. So there's various ways. We have a very complex distribution channel in South Africa versus many other countries in the world, and it's not always easy for everybody to understand it. On the wholesaler side, we have about 60 active wholesalers in South Africa. So yes, very complex, and all of it takes time and money and effort to get the drug to the end user.
Insofar as regulation is concerned, Mr. Masano, where do you start becoming, active, as it were? Is it at the level of the pharmacy? What about before? Are you responsible for any of that before?
Well, before that, because remember, when you have to become a manufacturer, you have to apply, and get a license to do that. So it's a process that involves both the Department of Health and the Pharmacy Council, because our part there involves what you call the good pharmacy practice standards, because you have to do this in terms of certain standards and stuff like that, because people who actually does the role in manufacturing, it's pharmacists, and especially what we call responsible pharmacists. So they play that role. So
we're going to talk a little bit more about the role that pharmacists play in the general healthcare system. But let's talk about how you regulate pharmacies and pharmacists, because oftentimes you walk into a supermarket and you come across Panado or some drugs, and how is this regulated? Who can have a pharmacy?
Well, we have pharmacists can own a pharmacy, but we also have what we call ownership regulations, for this and for pharmacy, which means that any person, any lay owner, can actually own a pharmacist. The condition is that you have to have a pharmacist in the pharmacy. If you have to this thing. So
if I have a supermarket down the street, I can decide that I want to have a pharmacy within that supermarket, and the condition basically is only that I need to have a pharmacist. Is that correct?
Yes, or yes. Let me put it that way, because I think you speak from what you are seeing as you go outside.
Correct. Yes,
you see this thing. Yes, but sometimes it also depends on the scheduling of these medicines, because schedule 0, I mean, you find it in a supermarket, which is not this thing, which will not necessarily be in a pharmacy. But supermarkets, yes, they have pharmacies in their this thing, but then they will have a responsible pharmacist who looks after that.
All right. Lorraine, let's talk about, shall I call it a real pharmacy? or the pharmacist now.
Yeah.
What role does a pharmacist play in the general healthcare system?
Okay. It depends entirely on where you are, where you will find a pharmacist. I think what you've been speaking about now is a community pharmacy, which is the traditional old retail outlet, but which nowadays offers more than just retail services, so it is a proper community pharmacy. You'll also find pharmacists certainly in manufacturing. And just by the way, as far as the community pharmacy is concerned in the corner shop, it is a little bit more complicated because of the fact that the premises themselves have to meet specific specifications, and obviously this isn't always possible. So they're not going to just be given a license, they've got to prove that they can control medicines. In the other areas of pharmacy, the pharmacist is also important, and so are the pharmacist's assistants, the pharmacy support personnel.
Right.
If you think about the hospital sector, and yes, we do have private hospitals, but we also have public hospitals, public community health centres, primary healthcare centres, and you're going to find that...
So it's quite a wide spectrum.
It's a very broad
I'll tell you what,
spectrum.
we're going to continue this discussion, but we just need to go for a quick commercial break. And after the break, we'll now discuss medicine registration and regulation issues around medication. Please stay with us.
MedShield Medical Scheme, we don't just talk health, we do health. At MedShield Medical Scheme, we don't just talk health, we do health. SMS MedShield to 33023 or talk to your broker to get your kind of care.
Now this is Trends, of course, your one-stop serving of all that's juicy and trending in the world of entertainment and showbiz. My name, of course, is Refill Wemwilo.
I'm Dr. Sello Mutaung, and this is Health Talk.
A very good morning and welcome to Media Monitor. I'm your host, Alicia Jolly.
My name is Dumile Matters.
What time is it? It's question time.
For your daily dose of current affairs, tune in to the SABC News Channel.
MedShield Medical Scheme doesn't just cover you when you're ill, we'll help you stay well.
Welcome back. So how are these medicines regulated in the industry? Perhaps let's put that question. We still have our three guests here in studio. I'm Amos Masango, CEO, Registrar of the South African Pharmacy Council. Tracy Minnie, Commercial Manager, Impact RX IMS Health. And Lorraine Osmal, Head of Public Affairs at the Pharmaceutical Society of South Africa. Now, we're talking medicines. But clearly, I mean, there's regulation issues. Medicines don't just end up in pharmacies. There's a process. Do you want to perhaps just take us through how a new drug gets to be on the shelves in a South African pharmacy?
Yeah, it's quite a process, and which involves the pharmacists, of course, all the way. Yeah. But remember, the drug has got to be manufactured in an approved facility, if I can put it that way. And it goes through certain quality standards, and once you have the product, then you have the whole chain of getting it down to the pharmacist. Yeah. I mean, Tracy spoke about the distributor. Yeah. It will go to the distributor, and then from the distributor it will go to the wholesale, and so there are quality processes. I mean, throughout this whole chain, and then to the wholesale, and the wholesale it might end up in a pharmacy.
But before that, I mean, there's the registration process. I would imagine for a new drug to be registered. Is it you or is the Medicine Control Council? How do you work together? Can you just explain the process? Yeah,
on that, I indicated earlier on that the process, for instance, of a license, involves both the Pharmacy Council, and then there will be the Department of Health, and then the Medicines Control Council. Once a manufacturer is registered, and then of course they will then submit their application, I mean, to register a medicine. And so that is quite a process also in that.
All right. Tracy, just take us through, this whole notion of a patent. And especially when it comes to newer drugs that are more expensive, there's the issue of the patent.
Yes.
And who sets that period, and why are these patent periods sometimes so long?
Well, as I mentioned a little bit earlier, one must remember that a lot of money is put into the research and development of a molecule. Once the molecule has been identified, they then have to start all the clinical trials. And that takes a long time, and it takes millions of dollars. So it's very important that the person on the street understands that when a product comes to market and there's a patent period, once a drug is on the market, there has to be time for that company that has developed that drug to actually make some of their money back. And in South Africa, for instance, the MCC, as was mentioned earlier, it is a timeless process to get drugs registered in South Africa. We have one of the longest registration periods in the world. So by the time the drug gets to market, it has cost a manufacturer a lot of money. Now, if they don't have time to make back that money, it then doesn't become worth it for them to launch it. So it's a balance that we need to ensure that there's time for them to make their money back, and then also to ensure that we in South Africa have access to the newer molecules and more advanced drugs.
It's going to be, I mean, it's, for us to focus on the question of the price, it may become a bit of a moral debate that will take us quite a bit of time, because what you mentioned there about making their money back.
Yes.
Is it morally correct to make money, and how much money? Whereas one can understand recovering your costs of developing the drug, but is it morally correct to make money out of something that saves lives? But that's, again, a discussion for another time. Now, the patent period. Oftentimes you hear that, and obviously this is a link to the price. You hear that because company X still has a patent, a company Y can manufacture and introduce a similar drug at a much cheaper price, but they cannot because of the patent period. Just take us through that.
I think we're very fortunate here. Yes, we need the innovator drugs. There is absolutely no doubt about that. Especially the way that our approach to healthcare has changed, and somebody needs to do that, and maybe that's where the financial incentive might come in, but that's, I'm afraid, not my field, so I'll keep quiet about it. But can I say we are fortunate in that many of the, much of the burden of disease that we face in this country can be treated by low-cost generics, and that has made it a lot easier, particularly for the public sector, to provide very broad health care. Yes, there are the patients who are going to need the more expensive drugs, but for most conditions there is an alternative available. And funnily enough, the price is, although the price from the manufacturer is something which the manufacturer gives a lot of input as to what his costs are, the eventual exit price from manufacturer has to be approved by the pricing committee at the Department of Health. And that is the price at which that medicine stays, so that you and I both know if we go to different places, we're going to pay the same price for the medicine, and nobody is going to exploit us.
We're going to come back and discuss the price in a lot more detail in the next segment. Tracy, she mentioned the generics, and so the generic market, if you're looking at the pharmaceutical industry in general, if you're looking at the generic market, is that growing?
Yes, it's growing year on year, not only for individual molecules, but the actual generic companies as well. So in the South African environment, our top performing companies in value and in volume are our generic companies. Currently they have about 60% market share, and it's growing all the time. And even within that, the Schedule 2 medicine takes a quarter, has a quarter of the total market. So, there's...
and in terms of usage now in the public, I mean, is the usage, what are the patterns of usage like if you compare, original products to generics?
Well, in our public sector, obviously because of pricing, generics are available a lot more than in private. In private, you also have that the patient can make a decision when they walk into the pharmacy. Do they want the originator drug or do they want a generic? Whereas in a public sector environment, a patient gets what is available or what is on tender. Okay. The other thing to remember with drugs is we have the originator and we have a generic, but we also have a wonderful thing called a clone. So, our clone business in South Africa, for people to remember, is a clone is a product that is made by the originator, but brought into the market at a less expensive price. And it's either marketed by them or it can be out-licensed to another company. Yeah. So sometimes we have the originator drug at a less expensive price.
Yeah, another moral discussion, but we'll get back to it. She mentioned scheduling, and in terms of regulation, how are medicines regulated in terms of scheduling? Perhaps what is scheduling of drugs? What does that mean?
Yeah, scheduling of drugs basically just means classification of drugs, yes, and who may use what at what level. For instance, you have prescription medicines which are from Schedule 3 to Schedule 6. And then you also have what you call the pharmacy-initiated therapy. That is medicines that can be issued by a pharmacist, which mainly involves Schedule 1 and Schedule 2.
So those don't require prescription, basically?
They don't require prescription.
And what are the rules in terms of prescriptions, as it were? Can pharmacists accept faxed prescriptions or telephonic prescriptions and so on? What are the rules there?
Yes, pharmacists can accept emailed, faxed prescriptions, but the rule there is that the pharmacists, before they dispense that prescription, they have to verify the authenticity of that prescription. Yes,
well,
and then once that
there's so much that we can talk about in this industry and the regulatory issue. Perhaps we'll call you back and have more discussions. But for now, thank you so much for your time. All right. So we need to go for a quick break. When we come back, we now focus on that only issue, price. After the break.
If we're talking health, then let's talk seriously.
It's so good, nothing else can replace just your slightest embrace. And if you only would be my own for the rest of my days, I will whisper this phrase, my darling, c'est bon.
Shield, embracing our members in good health since 1968.
On Network, we tell you about Africa's social media and technology landscape.
21st century economies rely on technology to truly thrive.
We have quite a comprehensive portfolio of interventions in the tech entrepreneurship space.
And Africans are using tech and social media to solve the continent's unique challenges.
App Nigeria is an online marketplace.
Radio Vibe is a social media platform for radio music.
That's Network with me, Pumelele Zondi, every Sunday at 7:30 p.m. Central African Time.
Shield, embracing our members in good health since 1968.
Welcome back. Now, what's driving the cost of medicines and general health care in our country? Well, here to tell us a lot more about this is we still have in our Joburg studio Lorraine Osman, Head of Public Affairs at the Pharmaceutical Society of South Africa. And with her is Tracy Minnie, Commercial Manager, Impact RX IMS Health. And it's a pleasure again now to welcome from our Durban studios, Dr. Stan Molwabi. Dr. Molwabi is the Principal Executive Officer for MedShield Medical Aid. Welcome to Health Talk, Dr. Molwabi.
Good morning, Dr. Mutaung, and good morning to the viewers.
All right. I'll come back to you just now, but I just need to start with you, Tracy. We're obviously talking prices now. Can you perhaps just give us a sense of the prices in general of medicines in South Africa, perhaps compared to other countries? And you can talk, originals versus generics versus the clones, as you described earlier.
Okay, so maybe we should go back to the beginning, is when a price is set, as was mentioned earlier, there's a pricing committee and the pricing is then set. And that is the price that the manufacturer then has to sell at. When a generic comes onto the market, there's often a bit of play in pricing, and most of the time the originator brand brings their price down as well. So, but if you have a look at the market in general versus other countries, I think in South Africa we've been looking as IMS Health, we've been looking at international benchmark pricing, and it's certainly something that I believe will be implemented in South Africa. And currently we are measured against New Zealand, Australia, Spain and Canada, and our pricing is very similar to those countries. The companies and the manufacturers in South Africa are very aware of our international benchmark pricing that's coming. So they've already started to align themselves to the pricing. But I think in some cases, especially for the higher scheduled medication, I was actually very surprised, pleasantly surprised, that we are very competitive versus the other countries.
But we compared with the developed world. Is it morally correct that our pricing should be similar to the developed world?
I suspect we should rather be looking at developing countries, and I would think, and sorry, I'm a layperson when it comes to pricing. Right. I would think that we should look at the BRICS countries. Yeah. But that's my personal opinion.
Just by the way, are there differences in prices for the same products in South Africa between the public and the private sector?
Yes, they are. And it's because for the public sector, the tenders are given out, and there's tender prices and there are our SEP prices. And often there's also a fluctuation in tender pricing because there might be an instance where the manufacturer doesn't have enough stock to give to the institution, and the institution might have to buy out product. But I don't think it'll ever be a case that the product would be more expensive.
Well, talk about the private sector, perhaps. It's more opportune at this moment to introduce our guest at the Durban studio. Welcome back, Dr. Molwabi. Dr. Molwabi, from a medical aid, point of view, firstly, perhaps tell us about expenditure. How much do medical aids spend in general on medicines?
Well, according to the latest available, and this would be from the 2015 Council for Medical Schemes report, the entire industry paid 16.6% of the entire healthcare spend on medicines. And that translates to about 20.5 billion rands. But that does not include the medicines that would have been dispensed when you are a patient in hospital.
Would that include over-the-counter medicines as well?
Yes, that would include over-the-counter and everything else that is dispensed by pharmacists, that would be dispensed by dispensing doctors. But that cost would not include the medicines that are used when you are inside the hospital. That is accounted for in the hospital spend.
So you mentioned about 16.6% or so. What has been the trend over the past few years? Is that increasing? Is it getting worse?
Well, it varies. I think for the previous reporting year, it was actually slightly higher, but in this reporting year that I'm quoting, the 2015 annual report, it just went slightly down from about 17 to 16.6.
All right. Now,
so it's fairly, if you were to say it would be around 15% on average, thereabout.
Yeah, all right. Now, within the medical aid industry, I mean, it's always an issue around, the cost of medication, and then, of course, with all different types of options, you have the so-called formularies. Now, to what extent does price influence the design of these formularies? Perhaps if we just explain to us what these formularies are meant to do.
Okay. Yeah, price does influence the formularies. So, in general, you have two types of formularies. You have comprehensive formularies and restrictive formularies. And the formularies is a managed healthcare tool that is intended to make medicines both affordable and accessible to those who are contributing to the lower options. So, at the end of the day, the intention is to ensure that even if you are on a low contribution option, you are able to access medicines at best throughout the benefit year.
So that
is the intention of formularies.
Would I be correct in then saying that if you are on a low contributing option, you will have access to mostly generic products and not so much the original products?
I think that would be a fairly correct assessment of how it happens. What happens is that the restrictive formularies, where there is a generic, the bias would be that those generics would be included in the formularies.
Now, does that necessarily mean, therefore, that people on these low contribution options only have access to poor quality care?
No, that would be incorrect. Formularies are drawn up in a very responsible manner to start with.
Yeah.
They would include all the medicine that you would need for most of the ailments that anybody would suffer from. So formularies are restrictive. Where they are generics, the restrictive formula would have a bias towards those, and this is to ensure that those on lower options can have those lower contribution. They have access to medicine throughout the benefit year. So it's not about lower quality medicine.
Right.
And I mean, the discussion earlier would have indicated that generics are not necessarily a lower quality medicine. Generics are equivalents of the originator medicines, and they are fairly controlled by the MCC to ensure that, and I think the most important parameter that is used, as you'll have discussed, is the bioavailabilities. In general, the generics have got similar bioavailability in the body as the originator medicines, and this is controlled by the regulator, the MCC.
Okay. Talk about the MCC and registration of new products. How do medical aids normally deal with new products that are introduced into the market, which are often, in fact, most times, at very high prices?
Most medical aids will have a health technology assessment division. Health technology assessment is basically to look at new technology as it gets introduced. You would then assess its necessity in terms of the clinical environment. By that I mean there is a conditions, if new technology is introduced, how clinically necessary is it to use this new technology? And then you'd also assess what is called the clinical appropriateness of new technology. So when it is introduced, whether it be medication or whether it be other diagnostic technology, you would look at the affordability and its appropriate use. So there is a health technology assessment process that ensures that when new technology is introduced, it is introduced appropriately, bearing in mind that there are cost implications.
All right. Perhaps at this point, I think we've dealt enough with this issue of cost, and we can never deal enough with it. Perhaps we move on to something else, but that after the break. Now we're going to look at the question of safety in terms of usage of medicines. Please stay with us.
If we're talking health, then let's talk seriously. Shield Medical Scheme doesn't just cover you when you're ill, we'll help you stay well.
Your doctors, nurses and pharmacists work hard to keep you healthy, but you are also responsible for your health. Pharmacists receive many complaints about problems that arise from misuse of medicines, but this is usually accidental. Unfortunately, medication errors happen. They happen in hospitals, in pharmacies or even at home. And sometimes people get hurt because of these errors. There are also many other dangers, such as using the medicine for too long a period of time, using them in ways they are not designed for, preventing prescribed medication from acting effectively, even causing severe reaction with chemicals you may be exposed to at home or at work. When it comes to children, giving them medication safely can be complicated, and many parents feel the pressure when a young child needs certain medications, knowing that giving too much or too little could cause serious side effects. By following a few rules, you could save yourself or someone else a lot of worry. Get the most out of your medicine and keep everyone safe. Be sure to understand the instructions and read the medication label to make sure it's yours and it's the right prescription. Having the right medication and taking it correctly is very important.
So welcome back. Now, the overuse, underuse or misuse of medicines can often result in wastage of scarce resources and can lead to widespread health hazards. Let's learn more about what this means. We still have our two guests here in our Johannesburg studio. Lorraine Osman, Head of Public Affairs at the Pharmaceutical Society of South Africa. With her is Tracy Minnie, Commercial Manager, Impact RX and IMS Health. And then, of course, in our Durban studios, we still have Dr. Stan Malabi, who's the Principal Executive Officer for MedShield Medical Aid. Now, perhaps let's start with you, Dr. Malabi. Moving away from the issue of price now, we're talking safe use of medication. Now, what do you, I suppose I'm talking about the medical aid industry. How do medical aids, deal with the question of, or at least impart this message of using medicines safely and responsibly?
Well, we'll do it in two ways. Firstly, earlier on we mentioned formularies, and formularies are part of managed healthcare. But from a safety perspective, managed healthcare would also have what we term clinical rules. And clinical rules are used in the environment to ensure that what we pay for is safe. So if, for instance, as an example, a prescription comes through as a claim and the claim is for medication for more than a month, we would then assess that, because in general, in terms of the Medicines Control Act, that if it's a chronic condition, you are allowed to prescribe for about a month, and then you have repeat scripts, and then a patient on a monthly basis collects treatment. So if a script came in and it's a claim, we wouldn't pay for over a month unless there is some other justification. So that is an example of a clinical rule that introduces the element of safety. And we also have limits for those that would be subject to abuse. If we use a class like benzodiazepines, we would have very strict rules about them being prescribed on a chronic basis, and this would also be done in consultation with doctors. We do have medical advisors and pharmacy advisors. If there are any doubts about certain claims, we would definitely not pay until we are assured of the safety elements of prescribing such drugs.
Okay. Now, Lorraine, it's obviously hugely important that the public know how to use medicines safely and responsibly, I would imagine. What's your message to the public in that regard?
Well, my basic message is speak to your pharmacist at the time that you are receiving those medicines, because that is the opportunity that you have to tie everything together. You've seen the medical practitioner, or you've seen a nurse if you were in a primary healthcare situation, and now you're going to go home. And that can be quite scary. And I'll bring us back to the topic of price. How expensive is it if I don't take my medicines correctly? Say I'm a diabetic and I do not use my medicines properly, and I end up in a coma in ICU. That's a heck of a lot more expensive than actually paying for the medicines and using them properly, because you've got to look at all those costs that can be avoided as well as what you're actually paying out. I think it's very important too, because remember Amos spoke about the schedules of medicines. Remember that the reason that you've got different schedules is it depends on the level of healthcare professional that you need to interact with. So now we're coming to medicines which needed you to go to the doctor in the first place, and therefore we need to make sure that you're asking the right questions. And our Pharmacy Week theme this year is use medicine safely, and we've used in our graphics that we have seen, and I know I saw we had one on a screen here, where we have said, let's take the analogy of a traffic light, and we have a specific order of things that are really important. Our red light, right there at the top, most important thing is I've got to, as the patient, ask myself, do I know what I'm taking? Do I know how to take it? Do I know how to store it? Do I know what that medicine actually is? Then, if I have doubts about any of those, I must ask my pharmacist, and I must make sure that these are the correct things, and I must know how to handle things. We mentioned side effects earlier. How do I handle the side effect? Can it be avoided if I follow the right procedure? Can it be minimized? Or when is it that important that I must come back and report it to my pharmacist, report it to my doctor, so that that I can actually inform the authorities that this wasn't an ordinary side effect. So we need to know all those things.
Yeah. Tracy, in a home situation, first of all, storage of medicines and children. Do you want to perhaps just comment about, on that issue, how to make that safe for children? I mean, children accidentally will consume these tablets that look like sweets and so on.
Yes. Well, I think it's a responsibility of parents or carers to make sure that, number one, medicine is always kept out of the reach of children. The other thing important at home is to make sure that you read the insert, the package insert, or to read the bottle, and to have a look at what correct storage is needed. Sometimes a medicine will say store in the fridge. Please make sure that it's in the fridge. Otherwise, it could actually become detrimental to your children. Make sure that it's locked in a cupboard. Fortunately, most pharmaceutical manufacturers now, the lids, I think most adults can't even open. It's very important. And also, the package inserts are there for a very specific reason. If you have any doubt, make sure that you go through it. Even if it's thrown away, you don't know where it is, if you Google it, you will find the package insert and read it. Very important just with storage again. People have always been under the impression that antibiotics for children that have been mixed must go into the fridge. there are some new antibiotics out there now that it's the worst thing you can possibly do because it becomes all sticky and then it's difficult to give to children and it makes them nauseous.
Yeah.
So very important as a parent or a carer to make sure that you know what you're giving your children and make sure that you keep it out of reach of their sticky balls.
Talk about antibiotics. I mean, oftentimes antibiotics are prescribed. We're not going to talk about whether or not necessarily, but in an instance where it is indicated for antibiotics to be prescribed, and they prescribed for 7 days, people start feeling better after 3 days, and they stop. Your comment?
Ooh, you really are pushing me in the hot seat today, because I have a personal opinion which is slightly different from the common professional opinion now. You will hear that there is a lot of evidence that you must stop when you start feeling well. The reason I have a personal dilemma with that is I don't want you keeping spare antibiotics at home. I don't want you taking antibiotics for the wrong indication. I don't want you taking only enough to actually build up more resistance to the antibiotic. So I think that for the consumer it becomes quite difficult, and I think the really important thing then is to make sure that the prescribers are prescribing rationally, and if we get that right, it should be found on the consumers if they're not demanding it irrationally.
And there's a whole notion of accepting, medication from others.
Yes.
Your comment?
I think women are the worst. Yeah, I think that's an absolute no-no.
Yeah.
Firstly, there could be another medication in a bottle. You give it to somebody and you think there's something in there, but it's not. Yeah. And also, you don't know what that medication could do to you. And just on that, our pharmaceutical companies take a lot of care to make sure that that there's safe medicine out there. And if you have any doubt, even if you can't go back to the doctor or can't go back to the pharmacy, get hold of the company that manufactures that product. They have regulatory people that can help you report adverse events. I think that's a very important thing that the man on the street understands, that if something's not feeling right, if something's wrong, report it, because you could actually be helping somebody else. You could save somebody else's life in the future.
If not sure, ask your pharmacist or your doctor. I think it's on that point that we're going to have to leave it. It's been a fascinating discussion. Lorraine Osman, Head of Public Affairs, Pharmaceutical Society of South Africa, thank you so much for your time.
Thank you,
Tracy Minnie, Commercial Manager, Impact RX, IMS Health, thank you so much for your time.
My pleasure.
And in our Durban studios, Dr. Stan Molavi, Principal Executive Officer of MedShield. Thank you so much for your time, sir.
Thank you very much, Dr.
All right, folks, well, that's all we have for you today, and I hope you enjoyed it as much as I did. Join us next week again on SABC News, same time. A reminder to please share your views and comments via our Facebook page, SABC Health Talk, and follow us on Twitter at SABC Health Talk. And remember that this show is going to be repeated today at 2 in the afternoon and again on Thursday morning at 5 a.m. I'm Dr. Solomon. Thank you so much for watching, and please do take care.
MedShield Medical Scheme. We don't just talk health, we do health.
Now this is Trends, of course, your one-stop serving of all that's juicy and trending in the world of entertainment and showbiz. My name, of course, is Refill Wemwilo.
I'm Dr. Solomon, and this is Health Talk.
A very good morning and welcome to Media Monitor. I'm your host, Alicia Jolly.
My name is Dumile Matez.
My name is Mpho Sedu. What time is it? It's question time.
For your daily dose of current affairs, tune in to the SABC News Channel.
MedShield. Embracing our members in good health since 1968. SMS MedShield to 33023 or talk to your broker to get your kind of care.
High blood pressure, medically known as hypertension, is a major risk factor for heart disease like stroke, kidney disease, and even eye diseases. When your blood pressure exceeds a certain threshold, we call it high blood pressure. Unlike many other diseases, hypertension has no symptoms, and hence it is called the silent killer.
In actual fact, high blood pressure is asymptomatic. That is why we call it a silent killer. There are other contributory factors that can make you think that it's because I'm sure my blood pressure is high. We do get some dizziness now and then. It's not actually a symptom as such. So with high blood pressure, you need to have it checked. Then we can say, this is your blood pressure.
According to the World Hypertension League, 4 in 10 adults older than 25 have hypertension. The unfortunate part is around 50% of these people are unaware of their condition. Of those who are aware, half of them do not take any action to control their blood pressure, either through lifestyle modification or medication.
The only thing that I know about, I do know some of the things about hypertension, but I know that it's a sickness. That's what I know first. Secondly, I know that it can be cured, or it can be prevented. Actually, not cured, it can be prevented by the people eating healthy food and gymming, obviously. And then, even though we would be keen at solving the problem, but we'll be affecting people on the other side. Those are your doctors, your pharmacists who produce the pills and so on. But yeah, because I value men, I value a human being rather. I would say let's focus on preventing high blood and kill the business side of it, which are the pills and the doctors.
What I know about high blood, it's caused when you're overweight. A weight factor has got to do with the high blood. To maintain your high blood, you have to exercise maybe 3 times a week, and you have to control your diet. And there's a medication to maintain that your high blood is under control. And there's certain foods to eat and certain foods not to eat also.
The good news is that blood pressure is easily measurable without any discomfort. And once you know you have elevated blood pressure, you can do something to prevent and control rising blood pressure and thus avoiding potential risk.
Untreated high blood pressure can lead a lot of people into a serious problem. And we take it very mildly. The complications are like the eyes. We get things like the pupil edema of the pupil of the eye. The macula also gets affected, and it's the sight.
Everyone can take steps to minimize the odds of developing high blood pressure and its adverse consequences.
I go to the gym every 3 days in a week. Then I eat good food. You must eat fruits. You must eat vegetable in order to control it the right way.
This is a deadly disease. So I decided to attend clinics, workshops bakhuluma ngayo indaba ze high blood ne sugar.
The Goodman Gallery is celebrating 50 years promoting art from all sectors of life.
Actively involved in social and political life of South Africa, and we really have been. It's been a fascinating place to be and to watch.
Your personal style is synonymous to your signature statement.
Style is unique. It is a representation of you, your personality, the things you like. It speaks on your behalf, and it just represents the kind of person that you are, your uniqueness.
It's hilarious, apart from anything else. It's the satire, the sort of commentary on what we kind of take for granted as we exist in daily life.
Vote for Wonder Boy with your heart. Vote for Wonder Boy with your heart and run at cinemas nationwide.
For your weekly dose of arts and entertainment news, tune into Trends every Saturday from 12 to 1.